Hi, my name is Dr. Staub and this is Dr. Hudson, and today we're going to talk about spinal decompression. Spinal decompression can be used for two applications mainly: cervical disc bulges and lumbar disc bulges, which are creating pain and dysfunction. Usually it's going to be a pain that radiates. So if it's in the low back that we have a disc bulge, their pain will go into their butt and progressively further down their leg as the disc bulge gets worse, depending on where it's located. With the cervical disc bulge or bulge in our neck, we're going to get pain in our neck. It'll usually radiate to the upper back, and eventually it'll start going down into the arm, shoulder, arm, and then eventually into the hand. Problem with these disc bulges are the worse they get, the more a person has pain, numbness, and eventually can cause atrophy. The traditional treatment for this was discectomies, where they would go in and shave away some of the disc and remove it. The problem with that is once you remove the disc, it doesn't come back. So it gets to be bone on bone at that point, and then that segment doesn't move well like it used to, and the problem is the segment above and below it will suffer. They'll usually have to work twice as hard, and eventually they'll become like the segment that had the disc bulge. They'll start blowing out too. So it becomes a slippery slope. We have a new treatment protocol now, and it's called cervical and lumbar decompression. We utilize this table to lengthen the patient, and in doing so, when we lengthen the patient's paravertebral musculature, which shortens over time, shortening creates a wrinkling of the disc material, and by lengthening the paravertebral musculature, it will suck in that disc bulge. Creates a negative pressure in the disc, and it actually sucks the disc bulge back in. It usually takes a couple of treatments. There's anywhere from 20 to 24 treatments, depending on where the disc bulge is and how bad the disc bulge is. The sessions usually take 20 to 30 minutes, and they're relatively painless, which is pretty similar to what people go through post-surgery, usually with PT alone. So it's like having the surgery's beneficial effect with just the therapy and no surgery. So you have no permanent scars, you don't lose any disc height, and generally the segment goes back to healthy. So we're seeing a really high success rate like with this, and gotten a lot of good reports. We'll have some testimonials posted so you can reference those. So Dr. Hudson's going to lay down and we'll demonstrate how the lumbar decompression lengthens the paravertebral musculature, thereby helping us to decompress the disc. So when the spinal musculature shortens, it creates this wrinkling effect not only in the skin but also in the disc. And when we lengthen it, it kind of sucks that disc bulge in, thereby that material has a place to go back into, being cartilaginous material. So first thing we would do is normally adjust the patient, and then after we do that, we get them on the table and start decompressing them. When we decompress them, we really want to lengthen them out. There's going to be quite a bit of pull to lengthen. Some people have kidded and said this is kind of like the rack meets a computer, and it sort of is. We want to lengthen their muscles as much as we can without tearing them, and the computer helps us to figure all that out. So as we said, this is mainly only for patients that have had disc bulges that are verified through MRI. So if you're one of those patients, you want a cost-effective method of fixing it without surgery, this is your alternative. So what we do is we program into the computer what kind of pull we want after we fasten the patient in there. They need to be fastened in their feet and in their torso. So we snap them in here so that their upper body doesn't move, and then we lengthen them here, and we set the computer up for a certain amount of force, and if you can see, we're going to pull at about 50 pounds, and it's variable. I can increase it to 55, 60, all the way up to 100 pounds and down to like 30 or 20 pounds, even 10 pounds. Generally, we'll start around 40 to 50 pounds. I'm going to start at 40 pounds with Dr. Hudson. And then we can program in how long we want it to pull for. And usually, as I said, we start anywhere from 20 minutes to 30 minutes, but I'm going to start with 20 minutes today. We also can program in how much it rests. So it goes through a period of pull, and the period of pull is going to be 15 seconds. And then it's going to go through a period of rest, and we program this into rest at 50% of that 50 pounds. So when it rests, it's going to go into a 25-pound pull. So it'll pull 50 pounds for 15 seconds, and then it'll cycle into that rest period of a 25-pound pull for 15 seconds. And then it'll repeat back into the pull of 50 pounds for 50 seconds, and then it goes back into rest for 25 pounds. And it'll keep cycling through those pulls and rests for 20 minutes. The patient can hold this stop button, and they can stop treatment at any given time by hitting the stop button. I'm going to stop it again, and we're going to start it up again just to demonstrate how the computer lengthens the table. So if we can get real close here, we're going to see when I run it out. Dr. Hudson, you want to hold the stop button? So the stop plunger's right there, so if it gets uncomfortable, he can stop it at any given time. When I run it out, you're going to see this space lengthen out. And as it does so, you're going to see the force increase and then decrease and then increase again as it senses how much it's lengthening it. So you can see how that is actually lengthening his spine. And it'll do so ever so gently for that period of 20 minutes that we programmed in here. And then it will shorten just a little bit, and you can actually hear it letting out some gas as it shortens, and then it'll lengthen out again, and you'll hear the compressor run as it uses that pneumatic pressure to distract out or add space into his disc. The nice part is when you initially do it, the patient will feel a little stretch. They don't feel as much of a stretch as it continues, but when they get off the table, a lot of them will note, wow, I really did feel that. I didn't realize how much it was stretching me until I was done. Generally, when they go home that day, they're going to feel a little relief. And that night, they may feel a little soreness from the stretch. The next day, they're usually going to report that they have that relief. We'll want to repeat the treatment to reinforce that lengthening. So again, if this was his or her spine, the patient's spine, and this is their disc matter, as their muscles shorten and the effects of gravity through spasm and whatnot, we get that wrinkling appearance of the disc. And as we lengthen their spine out, it sucks in that wrinkling, getting rid of that disc bulge. So you can call it wrinkling of the disc, or you can call it a disc bulge. It's the same thing. We've lost some vertical height of the disc. This is what it looks like. So here's a normal disc. And there's a disc bulge. As you can see, we've lost a lot of vertical height here. So that material needs to go somewhere when we lose that vertical height, and it's going to bulge out the side. It bulges as that nucleus comes out the side of the disc. And we're lengthening the segment out to help suck in that disc bulge. This is cervical and lumbar decompression. We demonstrated lumbar today. We're going to do a separate video to demonstrate cervical decompression. My name is Dr. Staub. We're looking forward to meeting in our office. The phone number is 480-990-2663 or 480-990-BONE. Thanks.